Music, please. Music. Your Excellency, you're welcome to this very, very important program, courtesy of the Kwara State Health Insurance Scheme. You're welcome, sir. Shall we take the national anthem? Let's be seated. Your Excellency, the Executive Governor of Kwara State, Malam Abdurrahman Abdurazak, the Honorable Speaker, Kwara State House of Assembly, Right Honorable Salu Yakubu Danladi, and other members of the House here present, the SSG, Professor Jibril Maman Saba, the Head of Service, Mrs. Susan Oluwale, members of the State Executive Council here present, the Executive Secretary, our host for today, of the Kwara State Health Insurance Agency, Dr. Mrs. Olubumi Jetawo Winter, top government functionaries, distinguished invited guests, gentlemen of the press, ladies and gentlemen. Thank you. Yes, once again, I want to welcome all of us. Please, all photographers should please take position. We don't want anyone to block the screen, please. Thank you. Once again, I want to welcome everyone to the official launch of the Go Live Access to Care program of the Kwara State Health Insurance Scheme. Yes, before we say something about this program, let us say thank you to God Almighty, as I'll be calling on the Honorable Commissioner for Health, Dr. Raji Razak, to please come and do the opening prayers.
Let us pray. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا صراط المستقيم اهدنا صراط المستقيم اهدنا صراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين صلوا على رسول الكريم.
Thank you. Ladies and gentlemen, before I call on the Executive Secretary of the Kwara State Health Insurance Agency, Dr. Mrs. Olubumi Jetao Winter, to come and give the welcome address, let me use this opportunity to tell you a little about this program, the Go Life Access to Care. Now, this program, by the special grace of God, 10 indigents from across the 16 local government areas of Kwara State are accessing care. They've been fully paid for by the Kwara State government. I think we deserve a round of applause. And of course, our treatment is for free at their selected facilities. Now, this program, we have 3 packages. We have the indigent plan, that is for those with no means to pay premium. They'll be totally subsidized by the Kwara State government under the Kwara State Equity Health Plan. That is for the poorest of the poor, those that are not purchasable. Now, the second one is the informal sector. That's people with daily income, and those that have no structured salary. This one is 6,000 naira. We are talking about vulcanizers, iyalojas, or daily commoners, people that sell things by the roadside and all that. Now, the third category is the formal sector. This covers formal public and private sector, those that are working, and it will be 9,000 naira per year per person. And of course, we have that for the family package, where it will involve a father, a mother, and 4 children. It will be 9,000 naira per year, and of course, the other family members, there will be a discount. So emergencies are also carried under the state insurance, and it is affordable because of its risk sharing. Everyone puts money, but not everyone is using at the same time. This is in line with a cooperative. You get more than what you put in. So both private and government hospitals have been empowered on this insurance. So meanwhile, ladies and gentlemen, to tell us more about this Go Life Access to Care, permit me to call on the Executive Secretary of the Kwara State Health Insurance Agency, Dr. Mrs. Olubumi Jetao Winter, to come and give the welcome address. Can we give her a round of applause, please?
Your Excellency, the Executive Governor of Kwara State, Malam Abdurrahman Abdurazak, Your Excellency, the First Lady of Kwara State, Dr. Mrs. Olufolake Abdurazak, ably represented by the Honorable Commissioner for Health, Kwara State. Your Excellency, the Deputy Governor of Kwara State, Mr. Kayode Alabi, the Right Honorable Speaker of the House of Assembly, Engineer Yakubu Saliu Danladi, the Chairman House Committee on Health, Honorable Razak Owolabi, and all honorables here present, the Secretary to the State Government, Maman Saba Jibril, the Head of Service, Mrs. Oluwole Mudupe, the Honorable Commissioner for Health, Dr. Raji Razak, and all honorable commissioners here present, the Chairman, Kwara State Internal Revenue Service, Executive Secretary, State Primary Healthcare Development Agency, Director General, Hospital Management Bureau, the Special Advisor on Health Matters, Professor David Dumadi, all our technical partners, gentlemen of the press, ladies and gentlemen. It is with great pleasure and honor that I welcome you all to this record-making and commitment-driven official kickoff of the Access to Care program of the Kwara State Health Insurance Scheme. This is a purpose-driven initiative of our governor, Malam Abdurrahman Abdurazak. Our governor has today demonstrated that in the face of a pandemic this big, he is committed to addressing the essential health service needs of his people. Truly, when there's a will, that you can always find a way. We live unprecedented times made evident by COVID-19 pandemic. Even the best of world economies have been shaken to their core. Countries that have invested in their health systems are better able to manage current outbreaks like COVID-19, future outbreaks, and other non-communicable illnesses. The only way our state and our country, Nigeria, is able to address the gaps in rising healthcare demands is to have affordable healthcare services of sufficient quantity and quality proportionate to our population. The launch of the Kwara State Health Insurance Scheme today provides one of the most sustainable and long-term solutions to addressing our existing and future health challenges. The scheme will make basic healthcare available and accessible to every inhabitant of the state, irrespective of their socio-economic class. Through public-private financing and participation of healthcare providers, both in the public and the private sector, we are well on our way towards achieving universal health care in Kwara State. The scheme would help